Hello, everyone. Today, we will learn about the most dangerous disease today, cardiovascular disease. What is it? What do you need to know? Make sure you watch till the end because I will tell you what you can do to protect yourself from cardiovascular disease. This video is for educational purposes only. If you have a medical emergency, please call 911 or go to the nearest emergency department. So let's start with the basics. What is cardiovascular disease? Cardiovascular disease is an umbrella term describing conditions that affect the heart and blood vessels. Over time, these conditions weaken the heart muscle or lead to narrowing and blockage of arteries, which can result in heart attack, stroke, heart failure, or sudden cardiac death. Let's talk about the major risk factors. The leading contributors to cardiovascular disease are well known and, importantly, largely preventable: high blood pressure, high cholesterol, diabetes, smoking, obesity, and sedentary lifestyle. Family history and aging also play important roles. Now let's discuss the symptoms. Why early detection is difficult. One of the greatest challenges with CVD is that it can remain silent for years. Many patients have no symptoms until the disease is advanced. When symptoms do appear, they may include chest pain or pressure, shortness of breath, dizziness or fainting, fatigue or swelling in the legs or ankles. Because symptoms are often subtle or absent, regular screening is critical. I want to share with you some simple things you can do to reduce your risk of cardiovascular disease. First, eat heart-healthy foods. Prioritize vegetables, fruits, whole grains, legumes, nuts, and lean protein. Minimize processed foods, sugary drinks, and trans fats. Second, exercise regularly. Aim for at least 150 minutes of moderate activity per week, such as brisk walking, cycling, or swimming. Third, quit tobacco completely. There is no safe level of smoking or vaping. Fourth, limit alcohol. If you drink, keep it to less than or equal to 1 drink per day for women, and less than or equal to 2 drinks per day for men. Fifth, know your numbers. Track your blood pressure, cholesterol, and blood sugar. Early detection saves lives. How is cardiovascular disease diagnosed? Initial evaluation begins with a physical exam, blood pressure check, and basic lab work. Additional tests may include an electrocardiogram, ECG or EKG, which detects abnormal heart rhythms or evidence of prior heart damage. An echocardiogram or heart ultrasound assesses heart structure and function. Stress testing evaluates how the heart performs under exertion. A coronary artery calcium score, a CT scan, measures plaque buildup in the coronary arteries. And cardiac catheterization is the gold standard for identifying arterial blockages. The treatment approach. While there is no absolute cure for cardiovascular disease, its progression can be slowed dramatically and complications can be prevented. Treatment strategies include managing underlying conditions such as strict control of blood pressure, blood sugar, and cholesterol, lifestyle modifications such as a balanced diet, regular exercise, weight management, tobacco cessation, and limiting alcohol, as well as medications such as antihypertensives, statins, antiplatelet drugs, or diabetes medications, which are prescribed according to individual needs. What can you do to protect yourself from cardiovascular disease? Well, first, prioritize regular checkups. Early detection is key. Understand your risk factors, both modifiable and non-modifiable, and work with your doctor to develop a prevention plan. Maintain a healthy diet, including plenty of fruits, vegetables, and whole grains. Limit saturated and trans fats, cholesterol, and added sugars. Exercise regularly. Aim for at least 150 minutes of moderate-intensity aerobic activity weekly, plus muscle-strengthening exercises twice a week. Keep a healthy weight. Being overweight or obese increases CVD risk. Manage stress effectively. Chronic stress can contribute to high blood pressure and other risk factors. Get enough sleep. Most adults need 7 to 8 hours of sleep per night. Poor sleep quality or too little sleep can elevate CVD risk. Don't smoke. Avoid secondhand smoke, too. If you do smoke, seek help to quit. Limit alcohol consumption. If you drink, do so in moderation. For most adults, that means up to 1 drink a day for women and up to 2 drinks a day for men. And now I want to share some additional tips. Take your medications as prescribed. This includes those for high blood pressure, high cholesterol, diabetes, and any other conditions you may have. Be proactive. Learn about your family's medical history and genetic risk factors. This knowledge can help you make informed lifestyle and treatment choices. Final word. Cardiovascular disease is the leading cause of death worldwide, but the vast majority of cases are preventable with the right lifestyle and medical care. Prevention is the best medicine. Protect your heart today, and you'll protect your future. Stay healthy.